Welcome to the Viral Diseases Notes. This is lesson LS3C in the lymphatic system grid. Um, just want to, before we get started, let you know that we're going to cover a lot of really complicated topics in this note-taking guide, and I am not a doctor. So I'm not expecting you to become a doctor by reading this either. And I want you to just kind of get a general understanding of viral diseases, how they're spread, how they were treated, what they look like, and mostly how you can protect yourself from them. Just know that you will not have to be writing word for word every list, every definition, every disease you see here. Just kind of, you're going to be picking and choosing some of the things that you think are maybe most serious or the most meaningful to you, or the that you are most interested in. So let's get started. So virus names. Many diseases result from a very specific virus, like you'll see on this list. While as others just kind of get a general name, a general virus cause, like the common cold or upper respiratory infection. There are at least 200 different viruses that can cause those things. And we just have a generic catch-all term called common cold, or even same thing is true for something like the stomach flu. But some of these I'm going to go through are very specific and unique. There's one called the Epstein-Barr virus, which causes something called infectious mononucleosis. Most of you would just know it as mono. And if you've ever heard of it or knew someone who had mono, it leads to being very tired for, I think, 6 to 8 weeks, long times of just lethargy and malaise and not feeling very good and not having any energy. But it's not life-threatening. It's just kind of really a bummer to have it for a long time. We've talked about HIV, human immunodeficiency virus, which causes the disease AIDS. And you can have HIV, the virus can be in you, but not actually be diagnosed with AIDS. And we'll talk a little more about that in this later on in this presentation. Then there's the human papillomavirus, which can cause genital warts. Now, warts don't sound like they're very life-threatening. They don't sound like a dangerous thing, but in females, those warts could cause cervical dysplasia, which is a precancerous growth around the uterus, and then that can lead to cervical cancer. So the hope is, with the HPV vaccine that you may have heard about, is that we can eventually wipe out this virus completely, like we've done with others, so we don't have any more instances of cervical cancer. I'm going to skip around a little bit. I'm going to now talk about RSV. You may have heard of this one, respiratory syncytial virus, and that causes lower respiratory tract infections in young children, especially babies or toddlers. The rotavirus, you may have heard of, causes gastroenteritis, stomach flu. There's other types of enterovirus and norovirus that can cause you to want to throw up or feel sick to your stomach. Varicella zoster causes shingles and chickenpox. And the West Nile virus causes the West Nile fever. Kind of a clever name there. Then, of course, the one we've all heard so much about lately, the coronavirus, is just one type of coronavirus that currently is causing COVID-19, which is what we're all kind of worried about. But it also causes a disease called SARS, which was more recent, a few years ago in the news, but not nearly as serious as COVID-19 has been. So these are just a few. Now, I skipped some. Why isn't there a single virus listed for the common cold? This is in your note-taking guide, and you can also kind of see here, there's hundreds of different causes. There are so many different types of rhinoviruses that can cause a common cold. And yeah, rhino does come from the same word like rhinoceros, but it means your nose. So it's something that infects your nose and your sinus passages. And the same thing is true for influenza viruses. They mutate every year, and they can cause the seasonal flu, and why we take vaccines for different flus every year is because there are so many different types of influenza virus that rotate and spread throughout populations. So these are just a few common ones, and there's way more that I didn't list here. How do they spread? Well, they spread usually from a person to another person, but there's a few other different ways that that can happen, a few indirect ways. Here are the most common ways that you would probably can catch one of these diseases. First would just be breathing in airborne droplets. So maybe somebody is coughing in a room and you're close enough to breathe in those droplets from their cough. I know it's gross, but each droplet can actually have the virus in it, and if it gets in you, now you are contaminated yourself. You've caught the virus. Fortunately, something like coronavirus is not spread that way. It has to be spread with direct touch, direct contact. So it's there directly touching contaminated things, and then it doesn't go through your skin. So just if it's on your fingers and on your hands, you're not sick yet. It's then touching your mouth somehow, your nose, your eyes, or somehow the virus getting inside of you. Um, there's also ways of getting it that you could eat food or drink water that's contaminated, and you might hear about people in certain remote areas getting viruses and sicknesses from drinking water that has not been filtered or sterilized. Of course, you've heard about certain viruses being transmitted through sexual contact with a person who has it. There are also indirect transmissions from person to person with, it's not directly from the person though, it's like a mosquito, a tick, a mouse can somehow transmit a virus from one person to another, like as the mosquito takes some of your blood, and while it's injecting its proboscis into your skin, it's also accidentally injecting something from someone else into you. And then you may have also heard about getting being bitten by an animal that was infected with a virus, like rabies. That's how rabies is spread, from animal to person or from person to animal and back and forth through these living things. So you don't have to list a lot of detail about all of those. You can really summarize and shorten those as you look at the list. But now let's talk about symptoms. And again, I have a lot more symptoms here than you need to write down, but symptoms of viral diseases really depend on what's the actual disease, which part of the body is infected, how old the person is, any other risk factors they might have. Some people may have a virus and not have nearly the same symptoms as someone else. So there's a lot of different catches for that. One common thing is that you might have a flu-like symptoms. So anytime you've ever had the flu and you recognize these feelings, you know that you don't feel good at all. Fatigue, fever, sore throat, headache, coughing, aches and pains. You just feel completely miserable, and it's usually pretty obvious to people around you that you don't look good and feel good. Anytime there's any kind of stomach, gastrointestinal disturbances, diarrhea, nausea, vomiting, that's probably a sign of a virus. We sometimes call it just a generic term, food poisoning. Basically just meant you ate something that your body wants to get rid of quickly. Irritability, malaise, being just not feeling right, kind of tired or feeling sick. Rashes, sneezing, stuffy nose, runny nose, swollen lymph nodes, swollen tonsils, unexplained weight loss. These are the things that doctors are asking about and looking for when you show up and you just say, I don't feel good. Some serious symptoms, though, these are the things you would actually really want to do something about. And I didn't want you to list all of them. I actually listed them for you in the note-taking guide, and I want you to write what you would do if you or someone you know has these symptoms. And I can tell you right now, the answer is seek immediate medical care. Maybe call 911, depending on how serious it is, but at least calling your doctor to tell them about all this and let them tell you what to do would be my recommendation. So a change in alertness or level of consciousness, that basically means passed out, can't stay awake, can't stay alert. Chest pain, that could indicate problems with the heart or lungs. A deep, wet chest cough that produces lots of yellow, green, and brown phlegm. I know it's gross, but that could be a sign of something kind of serious. A high fever, more than 101 degrees. Lethargy, unresponsiveness, just unable to get out of bed, unable to move. Seizures, that could indicate something going on with the brain. Shortness of breath, wheezing, difficulty breathing, all something to do with your lungs and your bronchial tubes. A stiff neck, that could be related to something to do with your brain as well. Yellowing of the skin and the whites of your eyes, that could indicate something wrong with your liver. So if you have any of these symptoms or you know somebody who does, you need to call a doctor immediately and let them tell you what to do. Now, who's at most at risk? Everybody. Everybody can contract a viral disease and has contracted a viral disease at some point in their life. Now, in some cases, they don't cause very obvious symptoms, but others can be pretty dangerous. And sometimes people have a higher risk factor because of their life and the way they're living, or what age they are. So people who are very old and very young. We already heard about that in the recent news with coronavirus, but those people have either a weakened immune system or their immune system is not developed yet if they're really young, because they're still building up those antibodies and learning, and their T cells are learning what to fight against. Their body's also much smaller at that little younger age, so they can't handle the same kind of infection rate that others could. Anybody with a compromised immune system, so if someone who has some kind of an immune deficiency disorder, AIDS, cancer, or going through cancer treatments, kidney diseases, any other conditions. If someone has recently had a transplant, an organ transplant, these are all people whose immune system, they say compromised, meaning their immune system is not what it should be. They're at risk. Any history of a chronic diseases that keep coming back, that's what chronic means. They don't go away. Asthma, COPD, which is a pulmonary disease, diabetes, tuberculosis, heart disease, these are risk factors for other viruses. Malnourishment, because if your body's not being given the right energy and the right nutrients, it's not going to be able to fight off the infection. Not enough rest and high levels of stress. And people who work too hard or people who don't get enough sleep might find themselves getting certain sicknesses and illnesses more than others. Not washing your hands frequently. We already heard all that. Especially before you eat, and especially after using the restroom or after touching something that a lot of other people touch. And we've all been hearing so much about this in the news, I don't even need to talk about it much more. Now, I know some of you are not thinking about sharing needles or worrying about unprotected sex, but I do feel like I have to be responsible and talk about it. Now, sharing needles is not just something that people who are taking illegal drugs do. It's obviously something people do for medical purposes. And you'll notice in a doctor's office, when a doctor gives you a shot, they don't reuse those needles. They throw them away. Or anybody who is diabetic is tossing out those needles in between each use. But even in a tattoo shop, that tattoo needle goes into the skin, and if they were to share or use that with another customer, that would be putting them at risk. So these are some of the things that could lead to higher risk of catching diseases. Now, this doesn't mean that they're guaranteed to catch them, and it doesn't mean that they're any different physically, other than their medical histories here, but they just might have a harder time not getting them. So, are there any cures? The answer really is no. There's no cure for a virus, but viruses are non-living, and that makes them a lot more difficult to treat. If you got a bacteria, you take antibiotics. If you have a fungus, you take antifungal. If you have a parasite, there's antiparasitic medicine. And all what those have in common is that they are basically poison the thing that's growing inside of you that's not supposed to be there. But you can't poison something that's not alive. You can't. It's not as easy to treat viruses. Um, and the good news is, the reason why we're not all constantly sick is that a lot of the common viral diseases, cold and flu, they're called self-limiting. That means that your body will only be sick for a short amount of time. Your body resolves the symptoms. Your body figures out how to stop the virus. Sometimes your white blood cells sacrifice themselves. They completely surround the virus and make it inactive. And there's so many amazing things that your body can do in order to recover. And also, the fact that you kind of don't get rid of that virus protects you against that virus again in most cases. So now you've got these antibodies, you've got this ability to fight it off so it doesn't get you sick anymore. Now, what will help you while you're sick? Well, doctors will tell you certain things you can do to help with the symptoms. They might help you sleep. They help you take away the pain. They help you get some strength back. And help you kind of fight the infection off. And Tylenol, ibuprofen, that can help reduce the fever so that you wouldn't have any problems with that, take away the body aches and pains. Many people who had died in the past from flu, it's not necessarily just the flu, it's the fever that kills them. Their body temperature goes up so high that their organs start to fail. Drinking extra fluids can help flush out viruses and help your body to remove the toxins that are building up. Getting lots of extra rest and sleep helps your body because it takes a lot of energy to fight off those viruses, and it takes a lot of energy to replace those things that are being used up. And maintaining good nutrition, eating well, eating even when you feel like you don't want to eat. That's the hardest part. Is sometimes these diseases make you feel sick to your stomach, but you need to somehow get something in you. Sometimes there's prescriptions that doctors can give, and in this part of your note-taking guide, I only want you to write, like, what does this medication, how does it help? We've already talked about the antiretroviral medications, which can help people with HIV to not develop into AIDS. Those slow the ability of the virus to reproduce. It helps the virus to not keep spreading as quickly. And they also, there's virus medications that people with HIV take that help their body create more white blood cells so that they replace the ones that they're constantly losing. Then there's something called the antiviral drugs, which slow down the severity of the infection. You may have heard of something called Tamiflu here, listed here. And what that one does is it helps you to just get over the flu faster. But not everybody can take this drug, so it's not something that will help everybody. Even antibiotics, which we already said doesn't destroy a virus, but sometimes if you have a virus, you develop a secondary infection like bronchitis, you develop pneumonia, some other bacteria takes advantage of your weakened state, and now you've got to stop that too. So these are some prescription medications that doctors can give. They also recommend some home treatments, some home remedies. Now, it might sound like it doesn't work, but in many studies prove that it does, because it at least helps you to have comfort. It makes you feel rested. It might minimize your symptoms. It might give you nutrients. That's what's so wonderful about chicken soup. Or even just chicken broth, chicken noodle soup. It doesn't have to have a lot of stuff in it, but the chicken soup, what's nice about it is that it gives you easy to digest nutrients. It breaks up the congestion, gives you lots of extra fluids, helps you keep up your strength even if you can't eat. A lot of studies have also been showing that vitamin C, echinacea, and zinc, these things might help your immune system. The vaporizer can help to moisturize the sinuses and help your body to get rid of all that mucus. And mentholated ointments, you might have heard of Vicks Vapor Rub, the stuff you put on your chest or under your nose that kind of helps you inhale this medicated odors that help you to break up that stuff that you need to try and cough up. Now, some diseases lead to other diseases, unfortunately, and viral diseases will make your body weaker, make more susceptible to other infections that come along. And these things that happen later, some of them are viruses, some of them are bacteria, some of them are just a cancer that's associated with it. So some of them, you only have to list 4 in your note-taking guide, so pick 4. But acute bronchitis, bronchitis is an infection in your bronchial tubes, the bronchioles. Cervical cancer, we already talked about, that HPV can lead to that development. Dehydration, not a virus, not a bacteria, but it's a serious condition that if you're not drinking enough fluids and you're constantly losing fluids due to the virus, that can be serious too and life-threatening. Other infections can come along, like ear infections. Oh, we've all felt that. Pneumonia, anytime the infection gets in your lungs and fluid builds up there. Seizures, as we mentioned before, shock and coma. Sinus infection is just, again, bacteria getting into that sinus passages behind your eyes and your forehead and all around your nose. And even asthma conditions are worsened by some of these viruses, and as you know, if you can't breathe, that can be pretty dangerous too. So you only need to pick 4 things on this list that you think are serious enough to write down. So how can we prevent them? Well, you can lower your risk, which we already talked about, and some of these things you can do here. I want you to pick 5 simple habits that you could add and start doing today to keep yourself safe. Once you're older and you're grown up, you want to be in a monogamous relationship, or at least be safe with your sexual partners. You want to avoid contact with your hands, your eyes, your nose, your mouth. The CDC and the WHO are saying over and over again, stop touching your face, especially when you're out in public. Avoid contact with someone else who has a viral disease if you can. But of course, if you're a doctor or a nurse, you can't. But then you have to make sure you are using certain techniques and universal precautions to stay safe. Covering your mouth and your nose with your elbow, sneeze in your elbow, not your hand. Eating a well-balanced diet, lots of fruits and vegetables with all those vitamins and nutrients. Getting enough sleep, using a sterile needle every time you need to use an injectable drug, or if you get a tattoo, making sure that they are using clean, unused needles, using appropriate antibacterial cleaners, and of course, washing your hands for at least 20 seconds anytime you touch something that you think might have been contaminated. And of course, some of those things are pretty obviously things you don't like to touch anyway, but just getting in the habit of washing your hands anytime you're about to eat, or anytime you just touch something that you think might be contaminated or gross. So you only need to list 5 things that you can do to protect yourself. Now we're going to talk about vaccines. We've already watched a video about that, and a little quick discussion about it is that many viral diseases can be prevented by vaccines, and that before vaccines were developed, some of these things were life-threatening. One of the diseases we've already talked about is smallpox. Has now been completely eradicated from the planet. It doesn't exist anymore. It's not causing people to be sick anymore. Polio is not active in the United States, but it is still active in other countries. And a lot of these other diseases, viruses you see here, they may not be all life-threatening, but they're definitely threatening to your lifestyle or your quality of life. So it's a simple thing to make sure that you have protection against any of these things that can be prevented. Just imagine, and on your note-taking guide, what would life be like today if we didn't have vaccinations, if Jonas Salk had never created the first one. So some of these things, like I said, chickenpox you can survive from, but it can really lead to some serious complications. Flu, most people have had it and get over it, but as I said, some people don't get over it. And some of these can cause certain cancers and certain liver conditions and certain other life-threatening, easily preventable things. At this point, if you want to talk to your parents and ask that if your vaccinations are up to date, that's between you and them and your doctor. You don't have to write anything down in your note-taking guide, but just maybe have a discussion about, have I got all my vaccinations? Are we up to date? And I'm sure that you are, but sometimes things kind of slip through the cracks and it might be worth asking. Thank you very much, and I hope you enjoyed this note.